I'm Kathy. I'm a dental hygienist and I work with Dr. John Artemako in Sterling Heights, Michigan. Today I thought I'd describe what a periodontal charting is, or a gum screening. You might have been at your dental office and they worked with you and they were doing some measurements along your gum lines, and they were moving along your mouth calling out 1, 2, 6, bleeding. You hear different things like that. Well, what does that exactly mean? My patients are really used to gum measurements. I do it each and every time they come in. Whether I use a microphone and call those numbers off into a computer, or I do an examination where we go along each area and I give them some ideas as to what I'm seeing. They are asking me, what were my numbers? How did I do this time? Or sometimes they even walk into the office and sit down and say to me, hey, I think my numbers are going to be better today. Or they might say, I think you might see changes. I've been slipping up. Telling me a confession, I don't know about that, but either way, my patients are used to gum numbers. It's very helpful. It's a roadmap for me, to tell you the truth. It lets me know exactly what I can do to help them. So let's picture it this way. Gum measurements represent the fact that there is a collar around the tooth. The collar is gum line. I call it a collar because think of it this way. If you had a buttoned up shirt on, buttoned at the top, here's your collar. Picture that as the gum line around your tooth, and kind of picture my neck as a tooth if you would. When gums are healthy, they're nice and firm, they're light pink, they look wonderful, and they feel great. That top button of that shirt is closed up. You can kind of go like this with your fingers and just gently put your finger under that collar. No problems, everything seems fine. That's in effect is how floss goes underneath your gum line. You can just go underneath a little bit, clean there, all is well. When gum disease takes hold in your mouth, what has happened then is that top button of that shirt is open. Now all of a sudden, the collar is looser, maybe pulling away from your neck or your tooth, so to speak. Now what can happen? Things are uncomfortable, infection can start under that collar, and when the measurements are taken, that's when we start hearing 4, 5, 6, or bleeding. Things are happening, changes are going on. What we know too about gum disease is that it's episodic or seasonal in activity. What that means is there can be flare-ups, it kind of simmers down, it causes its damage, it flares up again, causes some damage, kind of simmers down. If we check each and every time, we run more chance of finding it while it's active and doing something about it. So next time your hygienist or dentist says, I'd like to do gum screening on you, don't go, oh, I don't know, I'm nervous, or what are you going to find? Go for it, because it's really effective in helping them help you. Take care. I'll talk a little bit about some other topics. Oh, I wanted to let you know too, you can think of it this way. Think of a dock in the water, and if a storm were to come along and start washing out sand from around those posts, what would happen to the dock? Wouldn't it become kind of shaky like this? That in effect is what happens to your teeth with gum disease. As the disease takes hold, the bone around the roots of the teeth, which are destroyed by gum disease, are lost. The teeth become loose, just like the pillars of the dock do. So don't let that happen in your mouth. Ask for a gum screening if you haven't already had one. Take care. I'll talk to you soon. Bye-bye.